Thank you, Madam Chairwoman, and good morning, colleagues. Today, as the members have said, we're considering 13 bills. First, we'll consider several bills to make the Medicaid program more efficient by ensuring enrollment information for physicians and patients is up to date. Second, we'll consider the Shine for Autumn Act, legislation introduced by Congresswomen Castor and Kelly to close gaps in stillbirth data, research, and awareness to ensure that all moms have healthy babies. Third, we'll consider the Women and Lung Cancer Research and Preventive Services Act, legislation to move the needle on the alarming increase of lung cancer diagnoses among young women who have never smoked by commissioning more research on prevention and treatment. Unfortunately, we haven't reached bipartisan agreement yet on my legislation, the Innovation in Pediatric Drugs Act. I plan to continue bipartisan negotiations with you, Madam Chairwoman, and our ranking member, Mr. Pallone, and Congressman Bilirakis to identify an offset or a workaround to accommodate increased funding for the NIH Best Pharmaceuticals for Children Act program. The program is critical for studying new uses for drugs to treat children once the drugs lose their patent protections. I appreciate and thank the chairwoman, our ranking member, and Mr. Bilirakis for working with me on this important issue. It's hard to find an agreement, and I thank you and your staff for working closely with myself and my staff to get the legislation to where it is today. And where we are today, I believe, is very close to the finish line. I look forward to finding, as I said, a bipartisan solution. I applaud the work that's gone into the bills that are before us, and I look forward to this productive market, and I yield back.